Hello, my name is Alyssa Morales and I'm a TCC student. Being a college student and having a lot of college friends, there is something that really interested me. You know, the one thing that college kids are addicted to, the thing that keeps us up all night studying for the 8 a.m. exam, the drug that is most widely used on campus. Well, if you haven't guessed it yet, I am talking about coffee. So I started wondering, what does this drug do to our bodies? The good, the bad, and the ugly. So today, I will be addressing what coffee does to our body and hitting the three main regions of our body: the cardiovascular system, the nervous system, and the digestive system. Starting with the cardiovascular system, it includes the heart, the blood vessels, and the 5 liters of blood that it transports. And according to the Institute for Scientific Information on Coffee, it can also constrict your arteries, which can lead to a rise in blood pressure. However, the American Heart Association claims that there is no direct link between coronary heart disease and coffee. However, coffee really does release fatty acids and fatty tissues that can potentially clog arteries. The American Heart Association also says that 1 cup can raise your heart to over 100 beats per minute. So if you have anxiety issues, it could really make it much worse. So we've addressed the cardiovascular system and learned that coffee affects the heart, the arteries, and potentially the blood that it transports. Moving on to the nervous system, it includes the brain and the spinal cord. According to Dr. Charlotte Mathis, coffee is a stimulant to the nervous system, which can help and work as a pain reliever if you're in pain, but it can also affect sleeping patterns. Dr. Mathis says that insomnia has been linked to caffeine addictions or someone who drinks coffee almost every day, multiple cups. Dr. Mathis says that it affects the REM cycle of sleep, which is the deepest cycle of sleep. And it affects how people sleep. But coffee also increases alertness in the brain, which is why it affects our sleep. According to the European Food and Safety Authority, 1 cup can improve alertness and awareness by 50%. So, that's a lot. It also may lower the risk for Alzheimer's disease. According to the Institute for Scientific Information on Coffee, the caffeine can help prevent plaques and protein tangles in the brain that can also prevent diseases like Alzheimer's. The WHO has proven that coffee does not induce dependence, however. Many people believe that they're addicted to coffee, or they drink multiple cups a day and they feel withdrawal symptoms when they don't have it. However, there is no link between the addiction center in the brain and people who claim to be addicted to coffee. When the coffee is removed, the brain does not show any signs of withdrawal, but the body does. So we learned that coffee is a stimulant. It stimulates the brain, lowering the risk for Alzheimer's disease, reducing pain, and affecting sleep. But since coffee is a stimulant, it stimulates more than your nervous system. It also stimulates your digestive system. According to Erica Manning, she's a nurse who writes for Livestrong.com, says, coffee stimulates and increases the contractions in the bowels, which pushes out waste faster than usual. It could be a good thing if you're backed up, but it could also be a bad thing if you don't have a balanced diet, because it pushes the waste through your small intestine faster than normal, which does not allow your body to absorb the nutrients. Manning also says that coffee is very acidic, which for most of us we know, but it irritates the lining of the stomach and the intestines, which can cause gas or an upset stomach. It could also lead to heartburn. Coffee does one other thing to our digestive system. Have you ever heard of coffee breath? I know a lot of us have, and a lot of us believe it's caused by the potency of the coffee, but it's actually caused by the dry mouth that your mouth experiences after you drink a cup of coffee. Coffee is very, very dry, and it dries out your mouth. Since it's so dry, it also can act as a diuretic, which increases the blood flow to the kidneys and increases urination. So if you drink coffee and wonder why you pee so often, now you know. So we've learned that coffee can upset the digestive system and cause waste to move a little faster than usual. In conclusion, we've learned that coffee has its ups and downs in the body. It can increase your heart rate, your bowel movements, and your awareness. At the end of the day, it just depends on how much you drink. The bigger the amount, the larger the symptoms. So, even though coffee is the #1 drug of choice on campus, we are now aware of the pros and cons of it. Thank you so much.